During the winter, temperatures can plunge, and with that drop in temperature comes problems for workers, especially those who work outside. Cold stress can be a genuine hazard when you work outside, especially in the winter months. But you don't have to be in the middle of a blizzard to suffer a cold injury. Would you know the signs of hypothermia? Would you know what to do if someone you work with, or even if you yourself have a cold injury? Cold stress is the loss of body heat to the environment. Usually, cold stress injuries occur in extreme cold. Some of the most common cold injuries include hypothermia, frostbite, and trench foot. What should you look for to tell you if someone is experiencing cold stress or is on the verge of a cold injury? Difficulty focusing on tasks, loss of mobility and dexterity, feeling extremely tired, feeling the effects of the cold more quickly, such as getting colder faster after breaks, pain in your extremities. In addition to monitoring your own condition, you should be on the lookout for symptoms in those around you. You should look for slurred words or difficulty walking or standing, dropped tools or equipment, irritability or becoming angry, loss of dexterity or coordination. Hypothermia is a medical emergency that can be fatal if it is not caught and treated quickly. Hypothermia occurs when someone has an abnormally low body temperature and they are unable to move well, think clearly, or may even feel disoriented. But you should know, although hypothermia is most likely in very cold temperatures, it can occur even at cool temps above 40 degrees if someone is wet or soaked. The symptoms of hypothermia include intense shivering, exhaustion or drowsiness, confusion, euphoria, or memory loss, slurred speech, or even collapsing. Someone experiencing these signs should get medical attention immediately. Frostbite occurs when skin tissue freezes. Because frozen tissue is numb, victims are often unaware of their condition until someone else points it out. Some of the signs and symptoms include a burning sensation, coldness, numbness, or tingling, white or grayish-yellow skin, skin that feels unusually firm or waxy. To prevent frostbite, get out of the cold at first signs of redness or pain and get medical attention as soon as possible. Remember, do not rub or massage an area that is frostbitten. This can cause even more damage. Trench foot occurs when feet are exposed to the combined effects of cold and water. The signs and symptoms of trench foot include severe pain, tingling or itching in feet and legs, and swelling blisters or reduced touch sensation in the feet and legs. To prevent trench foot, keep your shoes and socks dry. If trench foot occurs, treat it in the same manner as frostbite. So you've learned about the causes and consequences of cold stress, but now let's talk about how you can prevent it. If you're working outside, create a wind shelter if possible. You can create a shelter by using thick plastic to block the wind, rain, and snow. Set up work-rest cycles. If possible, schedule work at warmer times or move work to warm areas. Take frequent breaks in a warm area. Your employer should provide a warming shelter when temperatures drop below 19 degrees Fahrenheit. Increase your food energy intake and stay hydrated by drinking warm, sweet drinks or broths. Keep your clothes dry. Remember that wet clothing chills the body rapidly, so you should dress in layers. Remember that you lose most of your body heat through your head, so try to always wear a hat, and be sure to protect your hands by wearing well-insulated gloves. Limit or stop use of nicotine, caffeine, or alcohol. All of these hinder your body's response to the cold and could impair your ability to properly judge the temperature. Remember, cold stress and cold injuries can occur even if it's not freezing temperatures outside. You should keep an eye on yourself and your fellow workers to help ensure no one falls victim to a cold injury.